We know that counseling of these patients, of young BRCA carriers with prior history of breast cancer, it can be quite complex, especially when we have to counsel patients regarding risk-reducing surgeries, such as risk-reducing mastectomy and risk-reducing salpingo-oophorectomy, because we have to take into account different factors. We have to balance the risk of relapse of these patients with their lack of clear data regarding counseling of these patients on the impact of risk-reducing surgeries. And we also have to take, obviously, into account patients' preferences and the impact of this surgery on the reproductive plans, quality of life, and other factors. So because of the difficulty of this counseling, our aim is to provide the evidence on the topic to help clinicians to counsel these patients and help the counseling. Prior studies indicated that prior studies provided conflicting results, so we were not really able to draw solid conclusion on the topic. This is why we did this study, and we firstly demonstrated that risk-reducing mastectomy and risk-reducing salpingo-oophorectomy were independently associated with survival, but we saw this association even after adjusting for all the potential confoundings. So we believe that our results are robust in helping the counseling of these patients. We demonstrated that risk-reducing mastectomy is independent associated with survival if compared both in BRCA1 and BRCA2 carriers. And we know that both BRCA1 and 2 carriers have high risk of developing a second breast cancer after a prior one. While for risk-reducing salpingo-oophorectomy, this association with survival were more pronounced in BRCA1 carriers compared to BRCA2. But we know that for BRCA1 carriers, the risk of developing ovarian cancer is higher. So it's one of the possible explanations for our findings.